5 things that I would not do with my hypothyroid or low thyroid patients. I'm Dr. Darren Scott, and I've been helping people for over 20 years get their life back from chronic illnesses like Hashimoto's disease, low thyroid, GI problems, and many others. So, first one is going to be, I would not tell a Hashimoto's patient that they have a thyroid problem, because they don't. The real cause is the immune system is attacking the thyroid. The thyroid's actually a victim, not the problem. Imagine you're getting attacked in the park and someone blames you for running in the park. Doesn't make sense. So it's an immune system problem. You've got to handle the immune system, and your thyroid medication is doing nothing to handle the immune system. Number 2 is I would not tell somebody that their thyroid labs are normal if I don't have a full thyroid panel, which means if I only have a TSH and T4, think about it. All of you probably only had a TSH and T4 and that's it, and they're saying your labs are normal. You actually need at least 10 markers to determine what the underlying cause of the thyroid symptoms are. And sometimes you need 11 markers. So I just wouldn't do it. All that tells you is, do you need thyroid hormone replacement if you're pulling just the 2 markers? You're not going to get anywhere with that really, unless you have just primary hypothyroid and all you need is thyroid medication, but that's really less than 10% of the people that are diagnosed with it, so wouldn't do it. Number 3, I would not rely on just the lab ranges that come from the lab with your results. Just wouldn't do it. Those are really, really broad and you miss a lot with those. For example, pull out your lab work. See if they pulled your thyroid peroxidase antibodies, TPO-AB. And then look at what lab pulled it. So if it was LabCorp, the reference range is 0 to 34. Now, look at your labs and see if it says Quest. Quest labs say 0 to 9. Mayo Clinic is 0 to 9. So depending on which lab pulls your lab work, right, will determine if you're normal or not normal. Insanity, right? We go off optimal ranges, not these big, broad lab ranges. You miss too much. Number 4, if you're taking thyroid medication and it normalizes your lab range and you're still having symptoms, I would never say, well, it's not your thyroid. It's all in your head. Wouldn't do it. Last but not least, I would never tell a patient it's all in their head. Your symptoms are real.